Hello everyone, welcome back to my channel. Today we're going to explore a really interesting concept in physiotherapy, proprioceptive neuromuscular facilitation, or simply PNF. So especially for the upper limb. So if you ever wondered how physiotherapists help patients regain strength, mobility and coordinations in their arm, this is a technique you definitely want to know about. Yeah. So, understanding PNF, the philosophy and core concepts. So, let's start with the basics. So, PNF is more than just a set of exercise, it is a whole philosophy of movement and rehabilitation. So, instead of focusing on problems, PNF focuses on patient strength to improve motor learning. So, it works on the idea that body functions as a whole, not as an isolated parts. So, that's why PNF patterns often involve movements that look more natural and functional rather than just simple and straight line kind of exercises. Yeah. So let's talk about some core concepts of PNF, that is manual contact, maximal resistance, verbal commands, and visual input. So coming to the manual contact, the therapist's grip helps guide the patient's movement and gives important sensory feedback. Whereas coming to maximal resistance, applied throughout the movement to make muscles work harder and stronger as well. So coming to the verbal command, so it must be really short, clear instructions that helps the patient perform correctly. And coming to the visual input, the patients are encouraged to watch their movement, which improves their coordination. So these principles combine to make PNF highly effective in rehabilitation. Yes, and while coming to the fundamental PNF techniques for rehabilitation, so as we all know, there are few common PNF techniques that you will often hear about. The first one is hold relax, the second one is contract relax, whereas the third one is rhythmic stabilization. So the first one, hold relax, where the patient rests, then relaxes, allows a deeper stretch, whereas in contract relax, similar, but with active contraction followed by relaxation to increase range of motion is present. Whereas in rhythmic stabilization, alternating isometric contractions that help improve joint stability. Whereas yeah, these techniques can be tailored to the patient's needs depending on whether they need more strength, flexibility, and stability as well. Yes, coming to the PN of upper limb patterns. So now we discuss it about practically. So D1 pattern is nothing but D1 flexion, in which looking like bringing our hands towards the mouth, shoulder flexion, adduction, and the external rotation and hand closing movement will be happening. Whereas in D1 extension is the opposite, moving the arm down and out with the hand opening. Functional uses, it's nothing but eating or reaching for objects like that. Whereas in D2 pattern, D2 flexion, in which lifting your arm up and out, like throwing a ball or reaching out overhead. Whereas in D2 extension, bringing the arm back down or across, like fastening a seat belt kind of stuffs. So these diagonal patterns mimic real life activities, which makes PNF so effective in restoring functions. Yeah. Yeah, this is what I told about the D2 flexion, D2 extension, and its applications, which we discussed earlier. Coming to the practical application and incorporating PNF into clinical practices. So, how do physiotherapists actually use this in clinic? So, then first, they assess the patient's deficits and set clear goals. Then, they select the right technique and pattern. So for D1, for example, D1 flexion for eating or D2 flexion for overhead reaching. Over time, resistance and complexity are progressed gradually. And finally, patients are often given a home program so they can continue practicing independently. Yeah, coming to the benefits of PNF for upper lip function. So the benefits are very pretty clear. It builds strength, improves range of motion, enhances coordination, and most importantly, leads to functional gains. So, in this period, we need to avoid stretching or resistance if there is an acute injury or inflammation or a fracture. So, we do not push the patient into pain. So, and always educate so that they understand and stick to the program. Yes, important consideration and contraindications. Coming to the conclusion, PNF is a versatile tool in physiotherapy. So, looking ahead, researchers are even exploring how PNF to be combined with robotics and technology to make rehabilitation more effective. So, have you ever experienced PNF techniques either as a part of patient or during training of your period? So, we'll discuss it on further videos, which will be even more interesting and informative.